It often starts suddenly, a sharp stabbing pain in your chest, or a tight pressure in your abdomen that feels like an overinflated balloon. In this diagram of the human torso, you can see how gas gets trapped on the upper left side of the colon. The physical pressure here refers pain upwards, shooting directly into the chest cavity and mimicking the early warning signs of a heart attack. If that same gas bubble forms lower, on the right side of the colon, the sensation changes. The pain becomes severe and localized in the lower abdomen, closely matching the symptoms of appendicitis or a gallbladder attack. Yet despite the severity of the pain, the underlying cause is routine. Producing and passing gas up to 20 times a day is a perfectly normal, functional byproduct of human digestion. Because gas pain can successfully imitate serious medical conditions, the information we are about to cover is strictly for educational purposes, not professional medical advice. Knowing the difference between normal biological exhaust and a genuine medical emergency is the first step to eliminating panic. Once you know you're dealing with trapped gas, the quickest path to relief is physical. A pocket of air is a mechanical blockage, meaning you need mechanical movement, like a short, gentle walk after a meal, to stimulate gut motility. You can also manually compress your abdomen. Lying flat on your back and pulling your knees up to your chest in the gas-releasing pose physically squeezes the intestines to force trapped air out. Other movements focus on release rather than compression. These women are practicing synchronized floor exercises, similar to the happy baby yoga pose. Along with using an elevated footstool to sit in a natural squatting position, these wide leg stretches relax the pelvic floor muscles so gas can easily escape. If stretching isn't enough, you can physically push the gas through your digestive tract using the ILOV massage. This nap shows the I Love You technique's path, starting at the lower right, moving up to the rib cage, across the belly, and down your left side. Following this exact one-way route is crucial to push gas out instead of backward. Combine this massage with deep diaphragmatic breathing. Expanding your belly rather than your chest creates internal space in the abdomen and gently forces pressure downward. These interventions allow you to physically manipulate your own intestines, forcing trapped air past biological traffic jams. Sometimes the intestinal walls are too tense for physical manipulation alone, requiring us to soothe the digestive tract from the inside. Sipping warm water helps relax those muscles. Herbal teas brewed with peppermint, chamomile, or ginger contain specific compounds that calm the gastrointestinal lining. Looking at these large sacks of spices in the market, we see the ingredients for a traditional internal remedy called Jeera Kashayam. Boiling roasted cumin seeds in water produces a soothing drink that helps reduce gas buildup. Over-the-counter options also serve specific functions. Medications containing simethicone work by breaking up existing gas bubbles, while enzyme supplements like alpha-galactosidase help your body break down complex sugars. Keep in mind that many of these digestive enzymes are primarily preventative. They are designed to be taken with meals, long before the gas ever gets trapped. Introducing heat and specific organic compounds relaxes the intestinal muscles from the inside out, allowing tightly trapped air to finally dissipate. To stop gas from trapping in the first place, we have to look at how air gets into the stomach. The medical term for the subconscious excessive swallowing of air is aerophagia. Aerophagia is often driven by mechanical eating habits. Chewing with your mouth open, eating too quickly, drinking through straws, and chewing gum all force extra air down your esophagus. The air you swallow is compounded by the gas your gut bacteria produce during digestion. These crates of raw, high-fiber root vegetables and leafy greens are highly fermentable, much like beans, onions, cabbage, and dairy. It might be tempting to cut out all of these high-fiber foods immediately, but doing so deprives your gut of necessary nutrients and damages your overall digestive health. A better strategy is to keep a daily food diary. By systematically removing and reintroducing specific carbohydrates through a step-by-step low FODMAP approach, you can identify your personal triggers. By auditing how we chew and what we consume, we stop the overproduction of gas before it ever reaches the intestines. Despite prevention and relief techniques, you must know when to stop self-treating and seek emergency medical care. An active hospital emergency room like this is where you need to be if your abdominal pain is accompanied by fever, vomiting, unexplainable weight loss, bloody stool, or if the pain is severe and does not resolve. Severe discomfort from a gas bubble is normal. Systematic failure of your digestive tract is not. Recognizing these red flags ensures you never treat a life-threatening emergency with a yoga pose. You now have a repeatable system for handling trapped gas: mechanical release through stretches, internal soothing through teas, and environmental control through mindful eating. Remember the biological reality of your body. Burping and passing gas are essential, healthy human functions, not embarrassing failures. If you experience chronic symptoms, always speak with your doctor to rule out underlying conditions. And for more actionable tutorials on how to manage your gut health, make sure to subscribe. Managing your digestion allows your body to perform its natural functions effectively without causing you pain.